ভিউয়ার্স, ওয়েলকাম টু মাই ইউটিউব চ্যানেল দ্য ফিউচার নার্স 24। আজকে আমরা অপসের বা মিডওয়াইফারির আজকে আমরা মিডওয়াইফারির ট্রু ফলস নিয়ে আলোচনা করব। এইচআইভি মে ক্রস প্লাসেন্টাল ব্যারিয়ার, ট্রু। তারপর কয়টাস ইজ টু বি অ্যাভয়েডেড ডিউরিং সেকেন্ড ট্রাইমেস্টার, ফলস। এজ অফ পিউবার্টি ভ্যারিজ বিটুইন 10 and 14 weeks years, true. Ultrasound is harmful during first trimester of pregnancy, false. Home delivery should be encouraged, false. In the fetal circulation, the ductus venosus connects the umbilical vein to the inferior vena cava, true. The term presentation refers to the long axis of the fetus to that of mother, false. Early feeding with up to 1 hour of birth is now widely recommended for newborn babies, true. Second stage begins with separation, descent and expulsion of the placenta with its membrane, false. The total amount of amniotic fluid exceed 1500 ml. The condition is known as oligohydramnios. এটা false. High parietal diameter is 8.5 cm, false. Anterior fontanel closes at the age of 18 months, true. The 3 or more consecutive spontaneous abortion is termed as missed abortion, false. Hydrops fetalis is not serious form of Rh hemolytic disease, false. Route of exchange transfusion should preferably through umbilical vein, true. The fetus develops from the inner cell mass of the embryonic, true. The umbilical cord has 2 veins and 1 artery, false. Downy hair in the preterm skin is known as milia, false. Head is born by extension, true. The decidua directly under the embedding ovum is decidua capsularis, false. Vault, base and face are parts of uterus, false. Caput succedaneum appears during labor, true. Amenorrhea presents in 75% cases of ectopic pregnancy, true. Induction to be done after 2 hours of onset of labor pain, false. Preeclampsia with convulsion is called PET, false. Hemorrhage means external only, false. Hemoglobin level less than 7 gram per dl is severe anemia, true. JSY is an entirely state sponsored scheme, false. Height of uterus less than LMP may be due to intrauterine fetal death, false. Vaginal bleeding before 20 weeks of pregnancy may be due to abortion, true. Fundal height remains at the level of umbilicus at 34 weeks of gestation, false. Normal size of uterus length is 7.5 cm, true. The total amount of amniotic fluid exceeds 1500 ml. The condition is known as oligohydramnios, false. Daily iron requirement during pregnancy 80 mg, false. Labor occurring before 37 completed weeks of pregnancy is called preterm labor, true. Pulling the cord without separation of placenta causes prolapse uterus, true. False. The umbilical cord lying inside the vagina or outside the vulva following ruptured membrane called cord presentation, false. Retraction or pathological ring cannot be felt vaginally, false. Rupture of membrane for greater than 24 hours before delivery is called prolonged rupture of membrane, true. The endometrium of the pregnant uterus is called trophoblast, false. Vascularized tertiary chorionic villi are completed on the 21st day of pregnancy, true. Fetal surface of the placenta is covered by chorion, false. Retained bits of placenta is not a cause of PPH, false. Methargine should not be used before delivery of the baby, true. HIV virus may cross placenta barrier, true. Anterior fontanelle closes at the age of 18 months, true. Maternal administration glucocorticoids is advocated in preterm labor, true. Pap smear collection is related to screening of cervical cancer, true. Duration of action of DMPA is 1 month, false. Retraction or pathological ring can be felt vaginally, true. Methargine should not be used before delivery of the baby, true. Coitus should avoid during second trimester, false. তাহলে আজকে আমরা এই পর্যন্তই পড়বো। এরপর পরের দিন অপসের এবং গাইনির যে ম্যাচ দা কলাম সেটা নিয়ে আলোচনা করা হবে। দেখো, প্রথম কোশ্চেন দ্য টোটাল লেন্থ অফ নন প্রেগনেন্ট ইউটারাস ইজ 7.5 সেন্টিমিটার। Montgomery's tubercle sebaceous gland. Retained bit of placenta may be the cause of PPH. Hormone which is responsible for stimulating lactation after delivery is prolactin. Implantation of a fertilized ovum outside the uterus is called ectopic pregnancy. Causes of antepartum hemorrhage: placenta previa, abruptio placenta, overdistension of uterus. Management protocol of uterine in perforation is observation of pulse and BP, assess the size and site of perforation, the amount of hemorrhage, laparotomy followed by repair. Causes of puerperal pyrexis, puerperal sepsis. Skin is covered with lanugo during 34 weeks of post conception. Chorionic gonadotropic hormone is secreted from syncytial trophoblast. In true labor, the contraction will be painful, regular, and bring about progressive cervical dilatation. Hormone which is responsible for stimulating lactation after delivery is prolactin. Gestational diabetes mellitus is a result of impaired carbohydrate tolerance. Medical termination of pregnancy is permitted up to 20 weeks. The weight of pregnant uterus at term 1000 grams. Physiological jaundice occurs second or third day of life. Physiological anemia occurred during pregnancy due to hemodilution. In atonic uterus, pulling the cord without separation of placenta causes inversion of uterus. Protrusion of bladder in the anterior vaginal wall is cystocele. Antenatal mother should attend at the antenatal clinic minimum 4 times. Menorrhagia is manifested by parvaginal bleeding excessive or irregular. Umbilical cord is attached at the edge of the placenta is called battledore insertion placenta. Carcinoma is in cervix. The uterus in stage 1 carcinoma is strictly confined to cervix. Relationship of the different parts of the fetus to one another attitude. The distance between the lower border of symphysis pubis to the midpoint of sacral promontory is known as diagonal conjugate. Following delivery or abortion, anti-D immunoglobulin should be administered to a Rh negative mother within 72 hours. In Bro presentation, the engaging diameter is to vertical diameter. The most common site of puerperal infection is cervical laceration. Earliest sign of pregnancy included hypertension is rapid weight gain. Commonest cause of breech presentation is prematurity. 1 IFA tablet contain 100 mg elemental iron with 5 mg folic acid. During uterine contraction test of pregnancy, the test is said to be positive if 2 lines appear. The commonest presentation is cephalic presentation. The commonest cause of maternal death in India is anemia. A birth hazard associated with this delivery is cord compression. Excessive oxygen therapy can cause of head floating in a primary gravity at full term is cephalodental fibroplasia. The decidua directly under the embedding ovum is known as decidua vasalis. The signs of fetal distress: fetal bradycardia, fetal tachycardia, meconium, aspiration, irregular fetal heart sound. Hegar's sign is positive during the following period of pregnancy: first trimester. Molding is overriding of skull bone. The reflex which is absent at birth, যেটা হচ্ছে absent থাকে. The chief purpose of doing episiotomy is to prevent tearing to the perineum. Endometrium during pregnancy known as decidua. Each cases seen at home should be managed by immediate transfer to a well-equipped hospital. The presenting party in transverse lies shoulder. Weakening occurs between 16 to 20 weeks. Most appropriate time of episiotomy when head is crowning. Clinical findings of true labor are descent with flexion of head, rupture of membranes, dilatation of cervix. MCH core includes antenatal, natal and postnatal care under 5 clinics family planning program. After ovulation has occurred, the ovum is believed to remain viable for 12 to 18 hours. Primary pelvic disproportion. Human placental lactogen hormone is secreted by cytotrophoblast. তারপর হচ্ছে ট্রু লেবার ক্যান বি ডিফারেন্সিয়েটেড ফ্রম ফলস লেবার বিকজ ইন ট্রু লেবার contraction will bring about progressive cervical dilatation. The nurse would suspect an ectopic pregnancy if the client complained of sharp lower right and left abdominal pain radiating to the shoulder. Physiologic anemia during pregnancy is a result of decreased dietary intake of iron. More reflex response is marked by abduction and then adduction of the arms. The ischial spines are designated as an important landmarks in labor and delivery because the distance between the spine is measurement of the inlet of the birth canal. তাহলে আজকে এই পর্যন্তই, আবার দেখা হবে তোমাদের সাথে পরবর্তী ভিডিওতে।